once in 2 centimeters झालं की you are in stage 2 पावता. So how to diagnose early? One important thing is mammography. You can diagnose this. I can assure you, no doctor in the world can diagnose this by hand. So you have to do some tests to pick up early diseases. Then once you find some lump in the body, we do a fine needle aspiration cytology. We just take a small needle, it's a OPD procedure. Just take a few cells, put it on the slide, and you can get the result. If your pathologist is free, maybe around 1 hour. If that is not giving, then we do a true cut biopsy. That means we take a tissue. Under local anesthesia, there is a gun which comes, you just fire the gun, a small tissue will come. Maybe it will take around 4 to 8 days for a proper histopathology to come. And sonography is most important, which is easily available. For the breast also, for liver also, spleen, kidneys, ovaries, everything you can look in one sonography. It's the cheapest investigation which is available. If you can't make out anything, then CT scan, MRI, PET scan. Now we have got PET scan also, nuclear medicine, bone scans are available. Different things are available, and some tumor markers are available. Like CA is for liver and colon cancer. CA 19.9 is for pancreatic cancer. CA 125 is for ovarian cancer. 15.3 is for breast cancer. So these things also can detect. I mean, we have a scheme also under Goa Cancer Society where we do all tumor marker for a regular patient. If you want to do yearly also, which is very cheap, 1,750 only. If you do individual one, it will cost you nothing less than 7,000 to 8,000 rupees. So it is Goa Cancer Society has done that. Now comes the staging. This is the most important. Stage 1, stage 2, stage 3, stage 4. This is because which stage you come to the doctor is very important for your survival. Because if you come in stage 1, your chances of becoming normal is almost like 90% and above. That means almost normal. You will have a normal life. Stage 2, it comes to around 80%. So you will drop by around 10% to 15%. Stage 3 is around 50 to 60% and stage 4 is around 10%, or God has to be really with you to help you out in this. So what is stage 1? Stage 1 is only tumor in the breast, less than 2 centimeters size. Nowhere disease is there. That means you are in stage 1, you will do well. Stage 2 is 2 to 5 centimeters tumor, nowhere else disease is there. Stage 3 is either locally advanced, you have from here, there is a glands which are big glands in the axilla, it means locally disease only. And stage 4 is from here, it goes to the liver, lung, brain, bones, anywhere outside. So it is very important that you come early. Early diagnosis saves life. Again I am stressing, you must come early to the doctor once you notice anything wrong with the breast. You come early, there are 3 advantages. One is you come early, it saves your life. Second is you spend less money and you have a normal life. Third thing, you save the organ. There is no need to remove the full organ if you come early. We can do a good surgery. If you want a plastic surgery also, it can be done and still looks as good as the other side. And the last is important is under DDSY scheme, actually government gives all operations, radiation, chemotherapy is free for early patients. Maximum money in cancer is spent in stage 3 and 4. And there you spend crores of rupees and your life is maybe increased by 1 year, 2 years only. While you come early, we can save everything, including your organ. Late diagnosis, you have a flat chest on the other side, now you can do plastic surgery, but that feel of normal breast will never come there. So the treatment, as I told you, surgery, radiation, chemotherapy, endocrine, targeted new therapies are now. Surgery is very simple. Either you do now conserve the surgery, means conserve the breast. You can just take out the tumor. You can go some glands in the axilla, and then you can give radiation and chemotherapy depending on your estrogen, progesterone, and other things. Radiation, we have the best machine, LINAC machine. Dr. Gunjan is here. Our medical oncologist, Dr. Jacob, is here. For pediatrics and lymphomas and other blood cancer, we have Dr. Swami. For PET scan, we have Dr. Matre. So we have almost a full gadget of doctors who can treat the patient under one roof. So patient ILOG can FNAC, true-cut biopsy, surgery, radiation, medical oncologists, everything can be done under one roof. Endocrine will come, the hormone therapy will come only if you are strongly ER/PR positive. And in advanced stages, now there is a target therapies are available. Early diagnosis, one is mammography, as I have told you. Second important is breast self-examination. This is very simple. There is no payment required to anybody. You have to just spend 5 minutes in a month for your own body. So this has come in Time magazine, so you can know the importance of that. So you stand in front of the mirror. You see that both the nipples are in one line, little bit over second machasta, but more or less in the one line. Lift both the hands up. Both the nipples has to go symmetrically up. This is the first step. Just takes around 30 seconds, less than 30 seconds. Then you just see if there is anything coming from the nipple. If there is a frank blood, you must immediately come to doctor. But that does not mean you have cancer. It can be just simple papilloma also. Then comes the palpation. This is important. Don't try to do like this. Then everywhere you will find lumps. You have to do with the flat of the hand, like this, how this. In standing condition, either you do like this or you do up and down. Then the same thing you do in a sleeping position, so that you can feel anything. So first 2 or 3 times you will feel that this is normal breast. Then something change occurs, then you will be immediately, you will know that there is something, this time I felt something new, so I must come to the doctor immediately. Then you can come to doctor, or maybe once in 6 months or so. So mammography also is another one. And in younger patient less than 40s and all, we do sonography, because we don't do mammography for a younger patient. So screening of the breast is around, this was the old one which was telling about 40s and out. Now we should do start at 30s, because we are seeing a lot of patients in the age group of 30 to 40. So maybe yearly sonography or mammography, whichever doctor advises you. Every healthcare professional, a doctor, so family doctor or the gynecologist or some surgeon has to see you once in a maybe year or maybe 6 months. And breast self-examination every month. Those who have stopped menses, they can do first day of every month. And those who have menses are on, then after 5 days of your stopped menses, you do the checking. You don't do when the menses are on or just pre-menstrual or immediately after menses, because that time the breast is turgid.